Health officials have approved COVID boosters for older adults and high-risk people, but there is still a lot of confusion over who should get a third dose. Medical editor Dr. Dave Nida is here to help clear things up. And Dr. Dave, there's a lot of mixed messages about who's eligible. So who do you specifically recommend get the shot?
Gosh, if you're confused over what's going on, you certainly are not alone. I think even those of us in healthcare are ping-ponging back and forth. We hear something from the White House, we hear something from the FDA, we hear something from the CDC, we hear things from advisory committees. Where do we stand at this point in time? I think if you look at this point in time where we are, it's definitely a booster for people who are immunocompromised, and technically for them it's not really a booster, it is a third vaccine. But when it comes to boosters, it is a third shot for people over the age of 65, people who have underlying health conditions, people who are in positions where they perhaps are at higher risk for becoming infected. Meaning, if you take a look at people who are in healthcare, people who are teachers, people who are grocery workers, people in jobs that involve public transit, there are just a long list of people that just rapidly expanded within the past several days over who is technically eligible to be vaccinated with that third booster shot there. I think though really what you got to look at though is this really is something that's being done or should be done on an individual basis, meaning what you have to look at is your individual circumstances. What does your job do in terms of putting you at risk for becoming infected with the virus, number one. And then you have to take a look at who you are around in your personal life. For example, let's say that you have parents or you have loved ones, friends who do have a risk for severe illness if they would become infected from you, if you would pass it along. You perhaps might want to consider ethically it would be fine to get in line to get that booster vaccine. And then I think you also take a look at it from a personal standpoint. How you feeling about COVID in the world today? I think a lot of us have been living on a high level of anxiety. A lot of us are very scared still at this point in time. And I think personally, the psychology part of this, or the psychological part of this, has taken a big toll on many of us. And so I think if you are in a place where you would feel better being vaccinated with that booster shot, please go ahead and do it. I think that it is a wise decision to make. We've been living under this cloud for way too long, and it's good to see that we have booster available.
Right, that was a lot of great information for people. What about people who receive the Moderna or the J&J vaccine? Are they not eligible for booster shots, or?
Yeah, when you look at it, we're really in a holding pattern. You know, half the people have gotten J&J or Moderna. There is no information on when those booster shots are going to be available. What we just talked about was just strictly Pfizer alone. So here's what the holdup is. At this point, Johnson & Johnson has not yet submitted all of their information on their trials with the booster to the FDA, but that should be coming pretty soon. When it comes to Moderna, they're actually not proposing a straightforward, here's your third shot type of booster. They're actually proposing a half a dose as being enough to give you a good immunologic response. And so their information is a little bit different to be reviewed. So that's why it's taken a little bit of extra time. I think, though, that what they are coming forward with to the FDA is going to be really good news. It does show that the third vaccine in the case of Moderna, a second vaccine in the case of J&J, do really provide a very good immune response. It really is actually triple what the initial immunization series really wound up producing. So there's excellent protection by that booster vaccination with both of those products. It's just going to be a matter of time, and I think it's going to be within the next couple of weeks.
Great. That's great information, too. We know Pfizer says tests have shown the vaccine is effective in children ages 5 to 11. How are these shots different than what adults are getting, and when do you think those might be available?
Well, I think at this point, we're really hoping we can get this approval pretty quickly. And I think that the information is going to get to the FDA really any day now. And I think for it to be reviewed and then approved, probably looking at about 4 to 6 weeks at this point in time. So I think, you start looking at that Halloween time frame as perhaps the time when the vaccine will be available to that age group. And in the studies, the vaccine to that age group has really been shown to be safe. It's been shown to be very effective. And what's different about it as compared to the adult dose is actually truly the dose. It is 1/3 of what we typically give to grown-ups. And the reason for that is kids in that age group just have such a robust immune system that they don't need much vaccine in order to produce a good antibody response against the virus. So they'll wind up getting 1/3 of what adults wind up getting in order to get that immunologic protection from COVID. And I can't stress enough how important it is to see this go through. We had within the past little bit more than a month and a half, more than a million cases of kids getting COVID. About 1 out of every 5 infections now are in children. And even though a lot of kids, they don't get very sick from it, there still is more than enough who do. And so we've really got to protect kids. It's good news that this vaccine is coming along and will be coming along quickly.
Absolutely. Well, thank you, Dr. Dave, for all the helpful information. As always, we really appreciate it. Great. And to catch any of our Q&A with Dr. Dave segments, you can head over to cbsdenver.com.